Now that we are all aware, today's call will be recorded, as these are very busy times together. Many people showed very much interest in joining us today, may have wanted to participate and listen in, but are unable to, and we want to give the opportunity to share this important conversation later. So thank you for understanding as we are recording today's conversation. Our accessibility accommodations today provided by the Department of Homeland Security, and many thanks to them, is our ASL interpreters, Bobby and Becky, who you will see spotlighted on your Zoom screen so that everyone can see them front and center. And we have a CART transcription that is embedded into Zoom. On your navigation bar on your Zoom screen, there is a CC button that should allow you to show subtitles, and you can also click on editing settings to adjust the size of the text on your screen. There is also a separate CART link if you would like to pull up the CART transcript on a separate screen, and that is in the chat. If you have any support technical difficulties, please do put a note in the chat for us and we will address it. And if you cannot access the chat and are having any accessibility or technical difficulties, please email us at directors@disasterstrategies.org. A few additional friendly reminders as we get started. Again, everyone is on mute, and we ask that you remain on mute when not talking to keep the background noise to a minimum. We will do two separate roll calls, one where Rebekah will lead our federal partner introductions and one where I will lead the disability community stakeholder introductions. And we appreciate knowing everyone who is on the line, so please do participate in the roll calls. Please also be mindful that many of our attendees are using assistive technology to participate. Please announce yourself before speaking every time, and we ask that folks please try to avoid using acronyms. I believe those are my accessibility reminders for today. And again, if you have any technical support difficulties, please put a note in the chat. We will address that. And if you cannot access the chat, please reach out to us at directors@disasterstrategies.org. With that, I will start again by saying hello, everyone, and welcome. My name is Shaylin Sluzalis again. I use she, her pronouns, and a quick visual description of me is I am a young woman with light skin. I have shoulder-length curly brown hair, and I am wearing a black shirt with white polka dots. And alongside me is Germán Parodi.
Hello, everyone. Again, my name is Germán Parodi. Along Shaylin, I'm the co-executive director of the Partnership for Inclusive Disaster Strategies. And again, welcome. I am a brown man. I'm a wheelchair user. I'm wearing a black turtleneck shirt with a grayish sweater. I'm wearing a headband, and I have my long hair pulled back in a bun.
And we together, this is Shaylin, are the co-executive directors of the Partnership for Inclusive Disaster Strategies. Before I explain a bit about the partnership and how we got here together, I first want to start by saying a big thank you to our colleagues at the Department of Homeland Security, Office of Civil Rights and Civil Liberties, for working with us collaboratively to bring all of us together today for this Department of Homeland Security and Disability Community Stakeholder Listening Session. And truly, many thank yous to Rebekah and Margaret for the hard work they've put to put all the pieces together to bring us together today. And again, many thanks for the accessibility accommodations provided today by you all. With that, a quick introduction about the Partnership for Inclusive Disaster Strategies, and we also are known as the Partnership. We are the one and only United States-based national disability-led organization with a focused mission on disability rights, inclusion, and the needs of people with disabilities, older adults, and people with access and functional needs before, during, and after disasters. Essentially, we are the boots and wheels on the ground response. We're community resilience and capacity builders, and we're the disability rights experts before, during, and after disasters. For folks that may not know, people with disabilities are 2 to 4 times more likely to die or be injured than their non-disabled peers during a disaster or an emergency. That includes public health emergencies, and as we all well know, this pandemic has put the spotlight on the disproportionate impact that people with disabilities are facing in congregate institutional settings, such as nursing facilities. We at the partnership know that community resilience is only possible when planning, response, and recovery is accessible to all and includes people with disabilities and others with access and functional needs as the key members of community preparedness and resilience initiatives before, during, and after disasters. And we thank you all for being a part of this resilience effort today. When disasters strike, emergency managers, responders, and community stakeholders often set up what are called emergency operation centers. And
One moment, this is Germán speaking. We're getting a note that the CART external link is not working.
Oh.
Could we get a confirmation from the CART interpreter, from the CART person on the
It is up and running, the CART, the captioner says.
Thank you so much.
And I re-put the link in the chat for anyone that may not have access to the CART link to bring up the separate transcription on a separate screen. All right, all good? Thank you. Accessibility is most important as we move forward in an inclusive space together, especially in these virtual times. So thank you all for bearing with us today. We at the partnership know that community resilience is only possible when we include people with disabilities and others with access and functional needs as the key members of the community preparedness and resilience initiatives. And we truly thank you all again for being here today and being a part of this. When disasters strike, emergency managers, responders, and community stakeholders often set up emergency operation centers. And we at the partnership do similarly with disability-led organizations to coalesce and work with key folks in the emergency and disaster responses. This includes emergency managers, public health officials at the local, state, and federal levels, folks at Red Cross and other first responders, and community-based organizations that are addressing immediate needs and issues for people with disabilities and others in the community. And what we call blue sky times, in order to keep conversations going, we continue to host, since our Hurricane Harvey response, weekly national stakeholder calls where a wide range of stakeholders with a shared interest in the disaster-related rights and needs of people with disabilities engage with one another. And we encourage folks to join us on those weekly calls, as many of you I know do, on Tuesdays at 3 p.m. Eastern Time. More about that on our website at disasterstrategies.org, and we'll be sure to put resources in the chat and follow up with information after the call as well. When the COVID-19 pandemic hit the United States, notably hitting the Kirkland Nursing Facility in Washington State first, we acted as we do in each disaster and set up a call to come together and identify how to address the urgent needs we knew were to come and have been present throughout this pandemic, as well as concurrent disasters in our country. We started this call back on February 28th of 2020 to draft a call to action that identified urgent issues to prioritize. That was sent to the previous administration's coronavirus task force, as well as several additional resources and recommendations that we've created since, as well as many of our partners across the nation. Since February 28th of 2020, we have been meeting each and every day, weekends, holidays, and all 7 days of the week, where partners across the nation come together to share good and promising practices, systematic rising issues, and community-wide advocacy engagement related to the rights and needs of people with disabilities during this public health emergency and concurrent disasters. Becky and Maggie, among others, leading by example, and other federal partners such as folks at the CDC that join our community-wide calls, have truly helped us dive deep into these systemic rising issues, work on possible solutions, and proactively work towards systemic change together within the roles that we each work in. On our daily calls, as they are focused on COVID-19 and disability rights, we have addressed several concerns that Becky and Maggie, among others, have worked with us on in the past and continue to. And the ongoing discussions on our daily calls are really what have sprung us all to work so hard together to come here today to begin the first step in addressing the urgent needs and issues that are facing people with disabilities across the nation, with the key folks and decision makers at the table, and that's you all. So we at the partnership and our fellow disability community stakeholders listening in, thank all of you, federal partners, for joining us and being here today and being a part of this important conversation and listening to us today as we move forward. So with that, I will pass it off to Becky to get us started, and many thanks again for being here today and having us come together to really begin this first step in the conversation. Becky? Becky, I cannot hear you.
You're muted, I think, Becky.
How about now?
Much
Good.
better.
All right, awesome. Okay, well, let me start over then. I just wanted to thank Shaylin and Germán for their efforts to organize this call so that we can hear from individuals about the concerns and experiences that you've had. And Shaylin, you've already shared quite a bit. For those who don't know me, I'm Rebekah Tosado, or Becky. I'm with the Office for Civil Rights and Civil Liberties. I am the section chief for the anti-discrimination group, and Maggie Schaefer, and I will be facilitating part of the call. Maggie and I are going to facilitate introductions, and Shaylin and Germán are really have organized the stakeholders and in terms of the issues they'd like to bring to us today. Let me just say that just one other reminder, Shaylin, I don't think you said this, but if folks can please, before they speak, and I think this will happen, say their names each time, because of course we're using CART and the sign language interpreter. Lastly, I think I'm joined today by my Czech Russell mix. That is Daisy Bell, and if I put myself on mute and turn it over to Maggie, that's because an ambulance is going by and she likes to howl, so we'll do that. But we do have a number of federal partners on the phone. We're very lucky to have our leadership, not only from the Office for Civil Rights and Civil Liberties. I think our new officer is running a little bit late, so she's not on the call right now, but we have leadership, other leadership from our office, Victoria Porto. Of course, we have leadership from HHS, from FEMA, from Department of Transportation as well. So thank you, welcome all. I will turn it over to Maggie so we can get started with the introductions, and then we'll have some opening remarks from our leadership, and then we'll kick it back over to you, Shaylin, so that we can hear from the individual organizations. Thank you. So Maggie?
Okay, great. Thank you so much. My name is Margaret, although I prefer to be called Maggie. My pronouns are she and her. I am a light-skinned woman with a blonde pixie haircut and dark framed glasses, and I'm wearing all black as usual. So I'm going to take this along pretty quickly because I know we want to devote most of our time to the important aspects of our discussion. As Rebekah mentioned, we are going to have with us today our Officer for Civil Rights and Civil Liberties, Kathy Collington-Gonzalez, also Peter Mina, who is our Deputy Officer, and Victoria Porto, who is our Director of Programs. At this point in time, if there's anyone else from CRCL on the call, I would like for you to quickly introduce yourselves. Going once?
Hi, Stephanie Fell from the compliance branch.
Okay, great. Anybody else?
Hi, this is Brian Parsons with Civil Rights and Civil Liberties.
Hi, Brian. Okay, in the interest of time, I will ask for people on the phone from the FEMA Office of Equal Rights to quickly introduce yourselves.
Good morning, everyone. My name is Megumi Fujita. My preferred pronouns are she and her, and I am the Deputy Director of the Office of Equal Rights. I'm very excited to be part of this listening session. Just wanted to share a couple of highlights of FEMA's efforts in the COVID and vaccination efforts. You may have read in the news that we have stood up a Civil Rights Advisory Group. Our FEMA's National Response and Coordination Center established the group to help ensure equity in the allocation of resources, including future allocations of the vaccine. And we call it the CRAG. And this includes members within FEMA from various program offices, but also it is an intra-agency effort. So we do have folks from HHS, CDC, HHS's Assistant Secretary for Preparedness and Response. And we have our friends here from DHS CRCL on the call as well. The CRAG is led by my office, the Office of Equal Rights at FEMA, and we are involved in evaluating the policies, practices, strategies, and plans to ensure that equity is baked into everything that we are doing in this effort. The other piece I just wanted to let folks know, we are actively engaged. FEMA and the Office of Equal Rights is actively liaising with the White House on equity issues and concerns in FEMA's vaccination distribution efforts. And we have deployed our civil rights advisors leads to every region to support FEMA's efforts in the region. So we've got some fantastic folks on the ground doing some fantastic work, and we're happy to be here. Thank you.
We're happy that you are here. That's great. Just a reminder that after this introduction, leadership from the various federal offices will have a few minutes to give additional remarks. So if others could hold those remarks until we get finished with this rundown of who's on the phone, that would kind of help things move more smoothly. Although, Megumi, we do appreciate that summary. It's good to know about everything OER is doing. Is there anyone else on the call from other offices at FEMA? And if so, please introduce yourselves. Okay, we're going to move on then. If anyone is on from the HHS Office for Civil Rights, can you please introduce yourselves?
Hi, can you hear me? This
Yes.
is Robin. Okay, great. Thank you. This is Robin Sue Ferbosi. I am the Principal Deputy Director of the Office for Civil Rights at HHS, which we refer to as OCR. And during this transition, I am serving as the acting director. My preferred pronouns are she, her, and I am light-skinned with about chin length, dark hair. And I am joined by other colleagues from the Office for Civil Rights. And I know that our Deputy Director for Civil Rights, Pam Barron, is on the phone. I also see one of our Civil Rights Division colleagues, Badr Tareen. And is there anyone else from the Office for Civil Rights who is on the phone? Okay, then that's the OCR contingent.
Great,
And
thank you, Robin Sue. Appreciate that.
Thank you.
And welcome. Next, we're going to see who's on the phone from the HHS Administration for Community Living.
Hi, good morning. This is Allison Barkoff. I am the new Principal Deputy Administrator and currently acting as the administrator for the Administration for Community Living, or ACL. My pronouns are she, her, and I'm light-skinned with curly shoulder-length hair and a blue sweater. I think we have a couple additional ACL folks on, so if people could introduce themselves, starting with Rima, please.
Thank you, Allison. Good afternoon, everybody. My name is Rima McCoy McDeed. My pronouns are she and her, and I am a fair-complected Black woman with large curly brown hair and large glasses. And I am honored to be here. I am the new commissioner for the Administration on Disabilities, as well as the director for the Independent Living Administration for the Administration on Community Living. And with that, if there are other ACL folks on, I will hand it over to you.
Hello, my name is Vicki Gottlish. My pronouns are she and her. I am the director of the Center for Policy and Evaluation within ACL. I'm a light-skinned white woman, and I have hair that's graying and growing out thanks to the pandemic.
Okay, are we finished with ACL?
One more from ACL. Hi, I'm Cronin, Deputy Administrator for Innovation and Partnership. Pronouns are she and her. A white woman wearing a greenish colored top with sort of light brown hair.
Thank you. Are we finished with ACL? Okay, now we'll go on to any other HHS components or agencies that are participating.
Yes, I am from HHS. I'm from SAMHSA, the Substance Abuse and Mental Health Services Administration. My name is Maggie Sherry. I have also she and her pronouns, and I have short gray hair, and I'm wearing glasses and light complexion. I have white skin, as we code in this country. And this will be my first time having a chance to talk or hear some of you, but I have worked in this field for quite a while, and I am the emergency coordinator for SAMHSA.
Great, welcome. Anyone else from HHS? Okay, I'm going to move on now to the National Council on Disability, or NCD. Amy, if you could introduce yourself.
Hi, good morning. Is it still morning? Hi, Amy Nicholas with the National Council on Disability. Thank you for having me here. I do know, or I see some familiar faces, and it's nice to see us continuing to work towards making a change so that things are accessible in the future. I've used she, her pronouns. It's long, I don't know, brown, blonde conflagration of hair, wearing a blue shirt with a black jacket.
Thank you so much for joining us, Amy.
Thank you.
And next on my list, I've got anyone from the Department of Justice Civil Rights Division.
Hi, I'm Renee Wallenhouse. I am with the Educational Opportunities Division and section in the Civil Rights Division. I am a white woman with short reddish blonde hair in a green top and purple shawl.
Thank you so much and welcome. Is there anyone else on from the Civil Rights Division?
Hello, my name is Clarette Yen. I'm an attorney advisor with the Disability Rights section within the Civil Rights Division. I use she and her pronouns. I'm an Asian woman with medium length brown hair and a blue shirt and dark glasses. Dark frame glasses.
Welcome, Clarette. Anyone else from Civil Rights Division?
Hi, this is Kristen Stitcher. I'm with the Disability Rights section. I use she, her pronouns, and I am a light-skinned woman with long light brown hair and dark frame glasses.
Welcome, Kristen. Anyone else on from the Civil Rights Division?
Good afternoon. This is Kyle Stock with the Special Litigation section. I use she, her pronouns. I am a light-skinned woman with long wavy red hair wearing purple glasses. And I think that's it. Thanks.
Okay, welcome, Kyle. Now I saw someone else joining from the Civil Rights Division.
Yes, hi, I'm Andy Washburn. I'm a civil rights program specialist for the Disability Rights section. My pronouns are he and him. I'm a light-skinned male with very little hair on top, but wearing black glasses and reddish brown and gray beard.
Welcome, Andy. Anyone else from DOJ?
Hi, my name is Hillary Valderrama. My pronouns are she and her. I'm an attorney with the Employment Litigation section of the Department of Justice Civil Rights Division. I am a light-skinned white female with light brown hair braided and also with glasses. Thanks for having me.
Yep, welcome, Hillary. Anyone else?
Good morning. Hello, my name is Alessandro Terenzoni. I am actually not with the Civil Rights Division. I'm the Deputy Director of the Office for Civil Rights of the Department of Justice's Office of Justice Programs. Okay. Pronouns are he, him. I'm a light-skinned bearded man with dark glasses and dark hair.
Welcome. Anyone else?
Hi, this is Lisa Zamt from the Immigrant and Employee Rights section in the Civil Rights of the Department of Justice. And I am not on camera right now, but I am not sure that my physical description then would be necessary. Thank you so much for letting me join.
Absolutely. Anyone else? DOJ. All right, welcome to all of you. Next, Department of Transportation. If there's anyone on from DOT, can you please identify yourself?
Hi, good morning and almost afternoon. My name is Irene Marion. I use she, her pronouns. I'm the new director of the Departmental Office of Civil Rights for the Department of Transportation. I would describe myself as a light-skinned Black woman with very short hair and big dark glasses, also wearing a red shirt and a cream jacket. Excited to be partnering with you all and learning more about all the ways that we can support this effort. And I am joined by, I think, at least 4 colleagues from DOT if they want to introduce themselves.
Sure.
Good morning. This is Barbara Dougherty. I'm the Deputy Director for the Departmental Office of Civil Rights at the Department of Transportation. My pronouns are she and her. I am not on camera today, but I am delighted to be here and have this discussion with all of you.
Welcome.
Thank you.
Hi, everyone.
Go ahead.
This is Yvette Rivera. I also work with Irene and Barbara, and my preferred pronouns are she, her, ella, and I'm olive skin complected, and I have brown gray hair. So, but it's really nice to be here with you all, and I look forward to the discussion. I know that I have 2 more colleagues on the call.
Sure, have them introduce themselves, please.
Good morning. This is Sarah Kluperdans. I am with the Departmental Office of Civil Rights. My pronouns are she, her. I am a light-skinned woman with long blonde hair, currently in a braid, and I have pink glasses. So thank you. Looking forward to the session.
Welcome. Others from DOT? Okay, we're going to move on. Anyone on from Housing and Urban Development? HUD.
Yes. Hi, my name is Alexandria Lippincott. I'm a trial attorney in OGC's Office of Fair Housing. I serve on the enforcement side, and my pronouns are she, her, hers. I'm white, light, with gray hair, pulled back in a ponytail, wearing pink.
Welcome.
I have at least 1 other colleague on the call.
Okay.
Hi, my name is Georgia Kendall. I don't have my camera on right now, but I use she, her pronouns. I'm with HUD's Office of General Counsel, Fair Housing, along with Alexandria. And thanks for including us.
Sure, welcome. Anyone else from HUD? Okay, that's the end of our call list here. I'd just like right now to open it up. Is there anyone else from federal agencies on the call that we have not heard from yet?
Good morning. I'm with Transportation Security Administration. My name is Bobby Moore. I'm the Disability Branch Manager with the Office of Civil Rights, Liberties, Ombudsman, and Traveler Engagement. I'm not on camera right now. I use she and her pronouns.
Welcome, Bobby. Anyone else?
Yes, this is Ann Hook Stratton. I'm with the Department of Education's Office for Civil Rights. I'm a white woman. I prefer she, her. I have gray hair, unfortunately. Thank you.
Okay, welcome, Ann. Anyone else?
Yes.
Hello, can you hear me?
Yes.
Yes, this is Judith Torres. I just started in my new position in Puerto Rico. I'm the Disability and Access and Functional Needs Senior Advisor for HHS ASPR for the recovery of Hurricane Maria. So I'm glad to join this. I know Marcy Rose. I know a couple of the person that are on the line. I'm very glad to be part of the team.
Welcome, Judith. Thank you for being here. I did hear from one other person.
Hi, this is Joey Gollinker. I'm also with Ed, Office for Civil Rights, and I use he, him pronouns, and I am not on camera today.
Okay, welcome, Joseph.
And this is Betsey Wigman, and I work with Joey at the Department of Education's Office for Civil Rights. My name is Betsey Wigman, and I use she, her pronouns, and I'm also not on camera right now.
Okay, welcome, Betsey.
Hello. I'm a co-worker with Judith. It's so good to see you, Judith, from Puerto Rico. I'm a branch director at the HHS ASPER Recovery Support Function here in the island. I work in the social services and schools branch. My pronouns are he, him, and I'm a fair-skinned Latino with short hair and a beard. Hello, everybody. Glad to be here.
Welcome, Rebekah. All right, does that do it? Oh, we have someone else. Go ahead.
Hi, hello. I'm Lisa Bothwell.
Okay, welcome.
I am speaking through the interpreters provided today. So I am light-skinned woman with light brown hair, and I am director for community living. Apologies for being a few minutes tardy to the meeting, but I am in the offices of policy analysis.
Okay,
and
welcome.
development.
Welcome. Okay, anyone else? This is great to have so many people involved. Okay, I guess, at this point, I think we're going to have Becky introduce, welcome, Kathy. I see you on there. If we could just do one quick roll call of the stakeholders according to our agenda, and then you and everyone else who are senior staff in the federal agency will have some time to describe your agency and what it is we do. Does that sound good? Follow the agenda. I'm just trying to stay in line.
Sounds great. This is Shaylin. Actually, Becky and Maggie and others, I'm wondering if maybe we could adjust the agenda and the community stakeholders could put their name, organization, and location in the chat for the sake of time, so that we can from you all. And if folks cannot access the chat, please send it to us over email, directors@disasterstrategies.org. It is very important for all of us to know who's on the line.
Right.
I think for the sake of time, we appreciate knowing you all who are here and the matter at hand. So I'll pass it back to you all.
Okay, great. That sounds like a great idea. Thank you so much for adjusting that way. And Becky, I'm going to toss it over to you now. Okay. You're on mute.
Okay, now I'm on.
Okay, there you go. There you
okay,
go. All right.
Yes. Hi, everyone. And I realized that I did not describe myself or give you my pronouns. I just described my dog. So give me 1 minute. I am a Latina woman, olive to light skin. I'm wearing a blackish and white top, and I have brown hair pulled back, and I wear glasses. So now you know. So Kathy Colleton Gonzalez is the Officer for Civil Rights and Civil Liberties. She joined our office on day one, and we've already accomplished, I feel, so much. I just want to let you know that Kathy has joined us. She was a little bit late because she was meeting with the secretary. So you see, that was extremely important. But I think now, Kathy, if you're ready, we'd love to hear some introductory remarks from you, and then we'll turn it back to Rob and Sue, and I believe Allison and Irene from the Department of Transportation would like to say a few opening remarks as well.
Thank you so much, Becky. I understand I should tell everyone I'm Kathy Colleton Gonzalez, the Officer for Civil Rights and Civil Liberties, and describe myself. So I just my last name. I'm Irish American. I'm not Latina. My husband is Latino. I have
Kathy?
embraced my silver hair and let it grow out. So you could say it's gray, but I prefer it to be.
Hello, Kathy.
Yes.
We cannot hear you well. I don't know if it's a connection issue. Maybe you could restart.
Or maybe try turning off.
Oh, you can't. I'm not. I have a bad connection.
Kathy, do you want to try linking from your iPhone? Or calling one of the numbers? This is Becky.
Shaylin, if everyone else can put themselves on mute as well, that could be part of it. And I see Catherine did join on a different device. Want to give it another try, Catherine?
So why don't we do this, Shaylin? We don't hear from Kathy in a half a minute. I'll see if Rob and Sue would like to make her introductory remarks and then turn back to Kathy.
I'm in the iPhone now. Can you hear me?
We can hear
Hi.
you.
Thanks.
Hi everyone. Can you hear me from my phone?
Okay, so Kathy, I think we can hear you a little bit better. Can you say a few more things? So Kathy, we're not hearing you. Let me connect with you offline. See if we can get a better connection for you. So I think, why don't we proceed and to the acting director for the Office of Civil Rights at HHS, Rob and Sue Fabrosi. Rob and Sue, if you wouldn't mind going next, and we'll get Kathy hooked up on the offline.
Yes, thank you, Rebecca. I'm going to keep my comments very, very short because I know all of us across the federal government really want to get to the point where we're hearing your views, because your views are indeed critical and why we've all gathered today. You can see the interest across the federal government. As many of you may know, because you have worked with us throughout COVID, the HHS Office for Civil Rights has been very involved in all civil rights issues and really focusing a lot on disability rights issues during COVID. We've been doing that through a variety of mechanisms. We've joined a lot of listening sessions and have been on partnership calls. We had a series of stakeholder listening calls with FEMA and DHS. We have issued a lot of guidance. We were fortunate to be able, right at the beginning of the pandemic, to get out a strong statement from our office that civil rights apply even during this pandemic, and then have definitely through our enforcement efforts and actually complaints that some of you have filed and that we've worked on with you, have been able to resolve a number of complaints ranging from the triaging policies of states to visitation and lots of issues, accessibility issues that have been coming up during COVID. And so if you are not familiar with our work, please do go to our website. I'll put the link in the chat box so that everyone has it for ready reference, but it's easy. It's hhs.gov/OCR. And what I wanted to tell you is we have a page, a dedicated portion of the website that specifically focuses on civil rights and COVID-19. So we are just really delighted to join all of you with all of our federal partners and look forward to your views. That's it for me. Thank you, Rebecca.
Thank you, Rob and Sue. This is Rebecca. So I think we do have Kathy back on. Kathy Colleton Gonzalez.
Hi, everyone. Can you hear me?
Yes, we can hear you now.
Oh, terrific. I am so sorry for the technical difficulties. I called back on my phone and I had Zoom on my laptop from my last job, but apparently it's not fully allowed on the DHS laptop. So my bad. I wanted to describe myself. I'm an Irish American woman, and I've married into a Central American family, thus the Gonzalez, and I'm light-skinned with a few freckles and silver hair, and I decided to wear my red, white, and blue today, so I have a red shirt on because I'm feeling patriotic again these days. So I joined as Officer for Civil Rights and Civil Liberties, was appointed by President Biden on January 20th. I am so pleased to be part of this listening session because you all are an important part of civil rights and civil liberties, and we're at a historic moment where we're hoping to turn things around. There have been so many problems for so many communities, and as we know, President Biden recently issued an executive order on racial equity, which is extremely inclusive of persons with disabilities. You are the public who we serve, and we know that the pandemic has had a huge impact on persons with disabilities throughout the Department of Homeland Security. And we're a big department. We include FEMA, but not HHS. And I'm very glad that we have our colleagues from HHS on the line as well. Very honored to be with you all. And I'm sorry that I was running a bit late. For those who might not be familiar with the Office of Civil Rights and Civil Liberties, we support the department's mission to secure the nation and our values by preserving individual liberty and fairness and equality under law. And that means everyone. This is the mission of the office and one to which I'm committed. I've been practicing civil rights law for over 25 years. And on my watch, I'm very committed to improving civil rights protections for persons with disabilities and all persons covered under law. And broadening that definition. Our staff, including Becky, does a fantastic job working to integrate civil rights and civil liberties into the many programs and activities of the department, and to support the component agency of the department like FEMA in meeting their civil rights and civil liberties requirements. As I mentioned, President Biden's executive order on advancing racial equity and support for underserved communities ensures that makes clear that as federal agencies, we need to include and advance equity for persons with disabilities. Just prior to joining the Department of Homeland Security, I was the director of the Office of Civil Rights Evaluation at the U.S. Commission on Civil Rights. And that's when I met Allison. She testified before us about some of the problems with of discrimination against persons with disabilities. And I examined a number of disability issues, and I was proud to say my staff issued a couple of relevant reports. Thanks also to Allison's testimony and so many members of the public who contributed. The issues may not be directly related to Homeland Security, but I wanted to tell you about my experiences and how moving they were to me. The work accumulated in a report about subminimum wages and a law that allows payment of subminimum wages to persons with disabilities and the impacts on the civil rights of persons with disabilities. And we found that there was a negative impact and the law should change. Another report that we did was about intersectionality. It was about school discipline and school discipline policies and their impact on students of color with disabilities. So we found that as there was racial discrimination in school discipline policies, there was also heightened racial discrimination for students with disabilities. And that was an area that hadn't been examined in the past that community asked us to study. I was very honored to hear testimony about that and to issue that report as well. This issue means a lot to me personally. Like most people, I have a person in my family who has a disability and I love her dearly. And I've seen her struggle because our policies are not good enough. But we're here to improve them. And a key part of carrying out CRCL's mission is an ongoing commitment to that improvement by engaging with you, with members of the community, to identify barriers to access to DHS programs and policies and push for solutions. Thank you so much for being willing to engage with us, and I'm looking forward to hearing from you all. Thank you.
Kathy, this is Becky. Thank you so much for those remarks. Let me, since you weren't here at the very beginning, just wanted you to know that Megumi Fujita is the deputy of the Office of Equal Rights at FEMA, is on the line with us, as well as some of the other leadership that you will you've seen already. So I think, thank you again, Kathy. Allison Perkoff introduced herself earlier on the call, and Allison, I believe you'd like to make a few introductory remarks as well.
Yes, thank you. And thank you so much to the Department of Homeland Security and FEMA for pulling together this listening call. I wanted to particularly thank the partnership and Germán and Shaylin for their work. It's I can personally vouch, having been part of these weekly calls for the last 10 months, the incredible work the partnership has been doing and really leading the site to identify the major issues and barriers that the disability community is facing. I just wanted to make a few comments like Kathy. I'm 2 weeks in on the job, maybe 2 weeks in a day. We both arrived on Inauguration Day. And I'm really pleased to say both engaging with ACL, there certainly had already been cross-agency and cross-department collaboration happening. But like Kathy, I really want to just highlight the incredible work that we are going to be able to do as we saw the executive orders and the national strategy on addressing the COVID pandemic come out from the White House about a week and a half ago, in part because the incredible advocacy of so many people that I see on the phone. Those plans really identified the unique needs and barriers of the disability community across a whole range of issues, not only in terms of equity, but talking about barriers in vaccine distribution, talking about the importance of ensuring that we strengthen home and community-based services that keep people with disabilities safe in their own homes and out of institutional settings where COVID-19 has really ravaged those settings. Making sure that we're thinking about access to PPE across all the different consumers of services, as well as the incredibly diverse workforce that provides supports to people with disabilities, including in their own homes. And I will say that ACL, for people who don't know, we have kind of two different buckets of activities. One, we have our own programs and networks, and that includes many of you who are on the phone from Centers for Independent Living and the Protection and Advocacy Networks, the Long-Term Care Ombudsman, the Protection and Advocacy Networks, DD Councils, USEDS. And in addition, we are tasked with being the voice within HHS and across the government on disability and aging issues. And we take that promise very, very strongly. We cannot represent the interests of our communities if we are not deeply engaging. And I'm really thrilled that we will be playing a pivotal role as HHS and the government are implementing these executive orders. And we will be there across the board to make sure that the unique needs of our community are raised and are considered as we're moving forward with these policies. So thank you again for including us. And I really also want to thank the incredible advocacy of all of the stakeholders who are on the phone for what you've done to get us to this point. And we have a lot of work to do together.
Allison, thank you so much. It's Rebekah Tosado. Okay, we really need to start getting into some of the meat of this, but before we do that, and I turn it back over to Shaylin, we have a new member of the leadership team, the new director for the Office of Civil Rights at the Department of Transportation, Irene Marianne. I believe she wanted to just make a few opening remarks as well.
Well, I will keep it short. Thank you again for having us. We're really excited to be partnering with you all, and really, I think today are here to listen. I really just want you to know that our team is tracking the work, that we are making sure that we are working in close partnership with our general counsel as they are engaging our modal administration. So we're especially mindful of what's happening in airports with the FAA and ground service transportation around mass use. And so we're caring and concerned about the safety of our workers, but we're also wanting to make sure that how masks are enforced in our spaces is definitely, I will say, we're being mindful, and we're trying to be as supportive of that conversation as we can. We're also really paying close attention to complaints and consumers' ability to make complaints, who is in charge of that, and how we're staffing up to help support complaint processes as well. So I'll work with my team and make sure that you all have access to information that's publicly available on our websites, and also invitations to upcoming listening sessions that DOT will be hosting. And otherwise, we'll turn it back to you all. Thank you so much.
Becky. Irene, thank you so much and welcome. So Shaylin, now we have some time remaining. So I will turn it over to you. I know you have organized what you'd like to share with us, and I would just, at least from the DHS's perspective, we are, if we run out of time, Maggie and I are always available to you and would be happy to share information with our stakeholders and other agencies as we usually do. So Shaylin, please go ahead. Thank you.
This is Germán from Shaylin. Thank you, Rebekah, and thank you to all of the federal partners that are able to join, and we'll be reaching out. Quickly, we'll be now passing it over to Marcy, one of our board members, that will give a overlay of where we are and how we got here and the impacts on the disability community, followed by Justin Shorter, who will give a clear explanation on the impacts on Black, Indigenous, Brown people of color, as its implications have been disproportionate. From there, we'll then introduce our bucket of issues as we've broken them out. But today is the beginning of conversations that we need to then take on individually with your agencies and components henceforth. Marcy?
Hello, everyone. I'm Marcy Roth. I'm the Executive Director of the World Institute on Disability and a member of the Partnership Board and one of its founders. My pronouns are she, her. I'm a light-skinned woman with curly COVID gray hair and red glasses. I want to welcome Kathy and Allison and others who are new to their roles. I've worked with some of you on disability civil rights enforcement in disasters since the September 11th terrorist attacks 20 years ago. Kathy, I want you to know that Becky and Maggie and the CRCL anti-discrimination team are among the finest examples of public servants that our government has. I can say this with confidence because I've worked with them on an almost daily basis since the earliest days of the establishment of the Office for Civil Rights and Civil Liberties. And you need to know that for all of you, each of you can work with us to optimize positive outcomes for people with disabilities and the whole community before, during, and after public health emergencies and disasters. As you all know, the federal government, as well as recipients and subrecipients of federal funds, are obligated under the Rehabilitation Act of 1973 to provide equal access to federally funded programs and services, including those that are disaster related. Additionally, the Americans with Disabilities Act of 1990 imposes an obligation to provide equal access to disaster-related programs and services. The Stafford Act was amended in 2006 to ensure that equal access and non-discrimination obligations are explicit in all Stafford Act activities. In its 2019 report to the President, Preserving Our Freedom, Ending Institutionalization of People with Disabilities During and After Disasters, the National Council on Disability reminded the Department of Justice, Department of Health and Human Services, Department of Homeland Security, Department of Housing and Urban Development, that they must monitor and enforce the Americans with Disabilities Act, its ADA Olmstead integration mandate, and the Rehabilitation Act obligation to use federal funds in such a way that people are served in the most integrated setting appropriate to their needs. They further reminded all relevant federal agencies to engage with national, state, and local coalitions of disability-led organizations and stakeholders. DOJ, DHS, HHS, ED, DOT, and FEMA have all explicitly reaffirmed what we all know, that there are no waivers to the civil rights protections of people with disabilities in disasters. Despite the clear obligations to people with disabilities in disasters, civil rights violations are flagrant. Monitoring and enforcement have been virtually absent, and the results have been deadly. I repeatedly raised these issues during my time at FEMA, in establishing the Partnership for Inclusive Disaster Strategies, and since joining the World Institute on Disability in 2019. While it's often said that no one could have seen COVID coming, many of us know that's simply not true. I participated in many pandemic planning initiatives in my 8 years at FEMA, and I repeatedly raised these issues then. The partnership first issued a call to action seeking to work together to protect the rights and lives of people with disabilities on March 6th, 2020. And here we are, 11 months later. I am equally furious and hopeful. These issues are not COVID issues, and we must not be COVID-centric in our shared commitment to achieving and sustaining equality for all. President Biden has committed to the consistent and systemic, fair, just, and impartial treatment of all individuals, including individuals who belong to underserved communities that have been denied such treatment. This applies to every single person with a disability. According to the CDC, that's 26% of adults, or at least 1 in 4 people in every town, city, state, and territory, as well as the tribal nations throughout our borders. Even though what happens before, during, and after disasters and public health emergencies is much bigger than simply what happens in a pandemic, I want to share some COVID numbers to help us all with the fierce urgency of the rest of this conversation and to center our work together, moving forward, beginning today. When we woke up this morning, we had a cumulative COVID death toll of 481,000 people. Approximately 40% of these people, 192,000 of them, died in nursing homes and long-term care facilities. This is 9% of all of the residents in institutions in this country. According to the 2018 American Community Survey, 96.3% of the people in nursing homes are people with disabilities. So no one goes to a nursing home because they're old. They go because they have a disability and the services and supports they need were not provided in their community. Thus, virtually all of the people in nursing homes who died, and virtually all who have survived thus far, are people who are entitled to civil rights protections. Further, CDC reports that 94% of all 481,000 COVID deaths were people with, quote, underlying conditions. This is a euphemism for disability. Other euphemisms are vulnerable, fragile, and frail. At points over the past weeks, people with disabilities have been dying at a rate of 2 or 3 every minute, with very few signs of civil rights protections in place. Many more are expected to follow. Most of these have been disproportionately Black, Indigenous, people of color, and other multiply marginalized disabled people. There are things we can all do now, and we will talk about several during our time together. Equitable vaccine distribution, relocation, equal access to emergency protective measures are just a few. I'm going to turn now to Justice Shorter from the National Disability Rights Network, who is going to focus on racial disparities in disasters. And you'll hear again from me, in a little while. Thank you.
Good afternoon, everyone. Once again, my name is Justice Shorter, and I am the National Disaster Protection Advisor at the National Disability Rights Network. A quick image description. I am a Black blind woman with medium brown skin. I'm currently rocking a free-flowing afro with a $1 million smile. All right, so let's just jump right into it. I also just want to make a quick note here. I am using a screen reader, so every now and again you might hear a little bit of a delay or a pause. Please just give me some grace because I'm listening while simultaneously speaking. All right. So the legendary South African songstress Miriam Makeba taught us that hope is a discipline. So on this first full week of Black History Month, I come into this conversation hopeful because there is good news. The good news is that most of us are well aware of the racial disparities, particularly laid bare or made more visible during this pandemic. So I need not belabor the point. At this stage, there have been multiple articles, reports, and accounts that acknowledge the unique challenges faced by Black people, faced by individuals with disabilities, and in wonderful circumstances, the challenges that they highlight, the challenges that impact Black, Indigenous people of color with disabilities. As it relates to compounded forms of discrimination, prejudicial treatment, implicit or explicit bias in healthcare, housing, education, transportation, employment, criminal justice, etc. However, the very inequities we are now experiencing and have been experiencing for the past year or so as it relates to this pandemic are emblematic of nearly every disaster and emergency regarding disproportionate impacts on historically marginalized populations in ways that directly lead to injury, death, and the destruction of property and equipment. So a couple of questions and examples as we go on our conversation to really gain a better understanding of the intersectional implementation of your work. And these questions and examples are, of course, posed to our federal partners today, and would love to continue it in future discussions by way of getting your responses to these. I would love to learn more information concerning the internal capacities of your offices to compile and analyze complaints or challenges by both race and disability. Too often they are singled out and they are separated. Far too rarely are they compiled in kind of one singular way to get a full-blown holistic understanding of how these two different categories or identifiers interact with one another and how people are being impacted. And so this would be inclusive, and we're talking about the way you gather information, this will be inclusive of other channels outside of your primary complaint process. So whether that be listening sessions or direct interviews with stakeholders, such as our session today, but whatever means of gathering information, I would love to know how you're doing that in ways that incorporate both race and disability moving forward. And if let's just go a little bit further, since we're talking about intersectionality, that should also be inclusive of LGBTQIA folks, because there are LGBTQIA folks with disabilities, should also be inclusive of individuals who just come from a myriad of different backgrounds. That of course includes gender as well. So I just really wanted to acknowledge that. I'm curious about any current efforts to instruct states on how to engage or accommodate undocumented folks with disabilities during disasters. I'm curious about any proactive strategies to help states guard against any heightened risk around financial and/or sexual exploitation of women and girls with disabilities throughout crises and emergencies, right? So I'm thinking about that in terms of human trafficking, right? So I know DHS deals with that in terms of its Blue campaign. So I'm curious if you guys have any additional information related to, again, the financial or sexual exploitation of women and girls of color with disabilities before, during, or after disasters. We know sometimes that perpetrators of these acts tend to seek out chaotic circumstances in order to really do things that are tragic and cause long-term residual impacts on individuals who they deem to be vulnerable, right? So I'm curious to see what you're doing around that. I would love if you could share any guidance on that you're providing to states concerning plans to protect the public safety of people of color with disabilities during acts of domestic terror, whereby violent individuals are openly roaming cities and neighborhoods, which directly threaten the safety, dignity, and belonging of people with disabilities. I can think about all of the people with disabilities who received a text message on January 6th saying that paratransit services will be suspended in the city from 6 p.m. to 6 a.m. I was curious about those folks who were people of color with disabilities who were left left stranded in their communities and didn't have access to get back home, or who were stranded outside of their communities and didn't have access to get to some of the vital resources and services that they needed. So I hope that there will be more done to ensure that the complaint process that you all have is well known and it's adapted to meet some of the complex needs of people of color with disabilities. And then how are these considerations going to be integrated into the monitoring and enforcement work of your offices? And how are federal partners intending to expand and deepen the work that you're doing in these areas? And then lastly, I will just ask, and I'm curious to learn more about how people of color with disabilities on your team, so these are individuals who actually work for you, how people of color with disabilities on your team are leading the charge to shape the scope and scale of how your respective offices are embedding equity into every single program, policy, and procedure moving forward. That's all from me. Back over to you, Marcy.
This is Germán. Justice, honestly, couldn't have said it better, and Marcy as well, with the impacts on people with disabilities, the impacts on multiply marginalized communities need to be front and center of their response. Collaboration, engagement, and the desegregation of data is paramount so we can make changes that need to happen today. Not to hold us up, Melissa Marshall will begin going into our issues around monitoring and enforcement priorities.
Melissa?
Sorry, I was having some difficulty unmuting. I apologize for that. I am Melissa Marshall, and I'm the Director of Operations for the Partnership for Inclusive Disaster Strategies. Good afternoon, everyone. Good morning, everyone, whatever applies to you. And I'm happy to be here today. I am a light-skinned woman with, I call COVID gray hair. That's shoulder length, also due to COVID. And I have purple wire rim glasses, and I'm wearing a black jacket and a multicolored scarf with purple and reds and greens and many, many different colors in it today. So, and my pronouns are she, her, and hers. As Marcy reminded us, and you're probably aware already, civil rights are not suspended during and after disasters, period. They are not suspended. During after disasters, emergencies, public health emergencies, including the pandemic. And the federal government organizations have the obligation to ensure that recipients of federal funds are in compliance with Rehab Act obligations and to ensure that the civil rights of people with disabilities are not denied. These obligations are pretty broad. It's not just about making buildings accessible, though that's incorporated in that. It's about providing equally effective communication to people with communication disabilities. It requires making modifications to policies and practices when necessary to avoid discrimination. And as I alluded to before, it requires providing structural physical access to people with disabilities. There have been huge problems monitoring access, not just throughout the pandemic, systematically for decades since the laws have been enacted. I'm old enough to remember when the ADA was signed. I'm also old enough to remember when the Rehab Act was signed, and there have always been huge problems in monitoring enforcement. I'm going to turn it back to Marcy, who's going to talk a little bit about tracking and enforcement.
Thank you, Melissa. This is Marcy again. And I'm going to tell a quick story. During one of the recent hurricanes, there was an area declared for mandatory evacuation. The partnership received a phone call asking for assistance from a family who had recently gone home with one of their family members receiving hospice care. And they had asked about support during a disaster, and they were assured that the hospice provider had a plan. During the evacuation, they discovered that that was not in fact the case. And while they were in a mandatory evacuation, they were at home in direct path of hurricane landfall with no way to evacuate. We initiated a complaint to several of your agencies using your complaint processes, and a process of finger pointing ensued. Every agency suggesting that, nope, this was not their responsibility, it was somebody else's. Fortunately, this particular family did in fact receive some assistance to evacuate to safety, but the only process that was available to them failed. And this is a repetitive set of circumstances in disasters. We do not currently have a process by which the likelihood of harm can be raised and the obligation to provide equal access in disasters can then be addressed before harm occurs. So we ask for the opportunity to work with all of you moving forward on how we can get a durable and reliable complaint process in place that doesn't require someone having already been harmed in order for responsibility to be taken. Furthermore, we need a whole lot more clarity about which organization, which agency is responsible for which pieces during a disaster. Is it FEMA? Is it DHS CRCL? Is it Department of Transportation? HUD? Where does DOJ's responsibility start and stop? Where does HHS's responsibility start and stop? We don't know. And I personally, and we have asked many times, who's on first? And nobody else can answer that either. So I ask that we address this huge gap and the need for life-saving and life-sustaining actions to be among your priorities moving forward. I'm now going to turn to Billy Altum from the Association of Programs in Rural Independence.
Thank you, Marcy. Hello, everyone. I'm Billy Altum. I'm the Executive Director of the Association of Programs for Rural Independent Living, or APRIL is our acronym. I'm a white guy. I'm dang near 60. I'm wearing a baseball cap today, or you would all be blinded by the light. So give you a little shot right there of the bald head. But anyway, I am thrilled to be on this call with everyone this morning and representing people with disabilities in rural America. I do not take this lightly. There are a lot of people out there in rural America who are scared, who are hurting, who are dying, and it's our responsibility to be their advocate. They do not have a voice. So I'm thrilled to be here on their behalf and speak on their behalf. So if I get a little excited, just know that it's the passion that's coming through, because this is of vital importance to people. It is actually life and death to our brothers and sisters all across the country. And I was asked to speak quickly about equity and some outreach into rural areas. So equity is one of my favorite things. I talk about this a lot, especially within the realm of transportation. So I was absolutely thrilled to hear that our DOT representatives are here. Also, if you see Mayor Pete, who is now our Transportation Secretary, tell him I'm thrilled that he has that job. At least we have someone again after our previous Secretary Fox, who does have some experience with transportation in a city. So it's just awesome to have somebody that we know has some experience. But one of the things I wanted to mention quickly about rural America and outreach into rural America is, how do people get their information these days? I'm still old school. Look, I still write stuff down with a pencil. That's how old school I am. So that's the way a lot of rural America still is. We're still pretty old school. We don't have a lot of broadband. I know here in Arkansas, we are continually working to expand our broadband efforts, but it's slowly, it just takes time. But how we get a lot of our info is through radio. I think it's the forgotten medium a lot of times for folks, but in rural America, we get a lot of info out of radio. So remembering where folks get their information. Still get a lot of stuff out of the print media, newspapers, which are a dying thing, but I'm still old school and I read the paper all the time. I was thrilled to hear the remarks from Justine earlier of how this is impacting our communities of marginalized folks, people who are Black, people who have multiple disabilities. One of the things I read just this morning in the Pine Bluff commercial was that a lot of folks are hesitant about getting the vaccination right now in rural America, especially our Black brothers and sisters, because, and I read this morning, they feel like perhaps the conspiracy theory that Hank Aaron got the vaccine and suddenly he passed away 2 weeks later. So there's, I don't know that I can take this. There's also the historical aspect of how people have been treated, the Tuskegee Airmen. And then some people, I read in there that they said, well, I see people get it and they get better. Not all of them are as serious as some. So looking at how folks get their information, that's incredibly crucial as how we proceed. We were talking about the ADA and civil rights. One of the things that aggravates me more than anything is that it is complaint driven. I get so damn tired every time I move. I'm having to advocate for myself, let alone the hundreds of people that I get to represent. So it's just absolutely infuriating a lot of times that it is such a complaint driven thing. And then you look at rural America and it's a totally different story there as well, because just due to the nature of how rural America is, we're smaller. We know each other. Hell, you can't damn near everybody that's in the community with you. So when you're an advocate and you're having a disagreement with these folks, wonder if they want to do business with me right now. I got to find all new avenues of doing stuff. So I'm looking forward to our folks with civil rights groups helping us with some of this enforcement. It's just, there's so many important things that we could be doing other than having to worry about things that should have been taken care of 30 years ago. So also within the, I'm going to get all of my stuff out at once before I turn the floor back over because we're going to run out of time. Lack of transportation options. Again, with my DOT folks, thank you so much for being here. If there's any time that I can talk with you, I would be so happy to share ideas with you. But looking at ways to use monies other than rolling stock. There are a lot of opportunities for folks, but people get hung up. I know we do here in Arkansas of just buying vehicles. There's a lot of activities we can do with those same dollars that don't have to be put into rolling stock. But anyway, again, my name is Billy Altum. I was thrilled to have this opportunity to speak with all of you. And I know I spoke incredibly quick, but again, there's a lot of information to get covered. And I'm just absolutely thrilled to be here with you today. So thank you. I yield back the floor.
This is Germán. Thank you, Billy, Melissa, and Marcy. We are explaining directly to you, to your Office of Rights, and one of your bread and butter, our complaint, and our community needs this to be a mechanism that works for us to essentially save lives, and so we can all obey the law. We're going to move things around a little bit to touch on ongoing issues that right now are affecting us the most. Move it up to Marcy and Kelly, share us some of the issues going on around institutionalization.
Okay, shift gears. This is Marcy speaking. So very simply, as we all know, there is an obligation to serve people in the most integrated setting appropriate to their needs, thanks to the Olmsted Supreme Court decision. Despite this and the shared understanding that there are no waivers to civil rights protections in disasters, HHS repeatedly issues waivers during disasters, during public health emergencies. And those waivers enable states to move people directly into nursing homes without the pre-admission screening that that is otherwise required. The minimal data set collection of information is waived. So there is very little information about who's in there or what their needs are. And as we all now know, if people did not know before, nursing homes and long-term care facilities, group homes, other congregate facilities are dangerous places for people to be. Now, with the death of hundreds of thousands of people with disabilities in these facilities, they are thrilled to open up their doors to relieve the hospitals, to depopulate the hospitals. So without the protections, people with disabilities are being moved from hospital beds, not because they need the services of long-term care, nursing care, skilled nursing facilities. They are moved out of these hospital beds into these facilities. Maybe they have COVID, maybe they don't have COVID. They are inadequately protected, and the others in these facilities are inadequately protected from them. And as we all know, the death toll continues to mount. So the 1135 waivers that are issued by the Department of Department of Health and Human Services is a clear violation of the rights of people with disabilities. And yet we continually see this process continuing. So it needs to be immediately addressed, and we need to stop bypassing those legal protections that enable people with disabilities to be institutionalized in disasters. I think we're turning to Kelly.
Okay, I wasn't sure.
Sorry.
Well, hi, everybody. This is Kelly Buckland with the National Council on Independent Living. I'm the executive director. I'm a white 66-year-old male who is dressed in black and wears a cowboy hat, which is black as well. And the background I have is the Idaho side of the Grand Tetons. Marcy laid this out pretty well, but I think the thing I just really want to drive home is we know now, I mean, and COVID has made it very clear, disability advocates already knew this, but COVID has made it extremely clear that home is the safest place for people to be. These congregate settings, including nursing homes, have always been places that killed people. And I put that bluntly because it's true and it's real. People go there and they die early. We've got studies that show that people's life expectancy once they go to a facility is shorter than if they stayed in the community. So we know that they kill people, and they really are killing people at great numbers at this point. So we need to stop people from going in the first place. I think where we have been centered is about getting people out. Well, it's so much harder to do once they're in there. The easiest thing to do is keep them out of there in the first place. So, and what's happened, especially with COVID, is that hospitals have taken, because of the extraordinary number of people that they've had to deal with, they have taken the path of least resistance, which is to basically discharge people to nursing homes because there's no work involved in it. You just send somebody to the local nursing home and you don't have to do any planning. So that's what's happening. People are just, and most people are given this option in a way that leaves them to believe that they really don't have any choice in the matter, that that's where they're going to go. The doctors basically say, well, for your health, you need to go to this long-term care facility because you can't be at home because you don't have the supports in place. Well, instead of putting the supports in place, they send people to a place that has a really clear history right now of killing people. So they're sending them to an unsafe place in the name of safety. So the whole point here is that we really have to also focus our energies, and I believe that Olmsted directs us to do that, we really have to focus our energies on keeping people out of these places in the first place, not just worrying about getting them out once they're there. So that's really kind of the point that I wanted to make. So with that, I'll turn it back over to Germán and Shaylin.
This is Germán. Thank you, Marcy and Kelly. And a couple notes. So we've added some resource on the chat. We'll be closing at the top of the hour, respecting all of your times, and our interpreters and CART always thank you. I do want to clearly make note that, as you see, community engagement is ultimate to saving lives. We want to thank all of you that have joined, and we need you to reach out to us so we can schedule on with your components. We were going to go into some crisis standards of care, as it is a rising issue, but to one sentence, yesterday here in Pennsylvania, where we physically are, our state told us we are waiting for clear guidance from the feds. That's what states are looking for, to push down to the counties on crisis standards of care. And if it does not happen, we'll have more death pits, as it was happening in El Paso and we've seen throughout in California. But as a clear rising issue that is much developing and we need action now is vaccines. And I'll turn it over to Todd.
This is Melissa. Hi.
Thank you, Melissa.
And Todd and I were going to talk about vaccines. I'm just scrolling around. We're trying to be nimble and get everything in at once. Vaccines, as everyone knows, are a huge issue. There needs to be a plan to prevent discrimination in vaccine distribution that encompasses equity in scheduling, providing equally effective communication to people, including sign language interpreters, making modifications to policies and practices, having accessible transportation to vaccine sites, making this sure there's mobile distribution at home, making sure people have informed decision-making, and making sure that it's transparent and that it's available, as Billy said, I'm going to steal Billy's thunder, in rural areas, and that there's no cost attached to that. There needs to be a plan. And you might say, this is a local issue. It's a local issue, but if there's federal funding involved, the obligation remains with the federal funder to ensure that this is provided without discrimination and provided equally to people with disabilities. So there needs to be access there, and need to comply with sections 504 of the Rehab Act. And for the Department of Justice, you know about complying with ADA. And you do enforcement on that. So that's quickly on vaccines, but we need guidance. Again, the states are asking for guidance. We know it's a state by state decision, but states have talked to me and asked for me about what is the guidance from the federal government around this? Not so much the CDC guidelines, but what are the guidelines around making things accessible? So again, states need guidance, and as recipients of federal funds and sub-recipients of federal funds, that needs to happen. Thank you so much. And I'm going to turn it back to Germán.
Thank you, Melissa. Todd, you on this.
I'm going to yield my time. This is Todd Holloway. I'm going to yield my time in the interest of possibly answering a few questions.
This is Germán. Thank you, Melissa. We will be early next week sending you a lot of reinforcing documents.
Germán, we can't hear you.
Can you hear me?
Now we can.
We will be sending you reinforcing documents around all this early next week with the help of Rebekah. And please reach out to us.
This is Shaylin, and just to quickly add that we did put several resources in the chat. Everyone, as Germán mentioned, to reach out to us and really continue this engagement by joining one of our stakeholder calls or one of our daily calls.
Shaylin, you're breaking up too.
Hi, it's Becky. Can you hear me?
Yes.
Yep.
Okay. Thank you so much. Thank you to all of our federal partners. Thank you for the disability organizations for your strong, important comments. I know we don't have, we only have a minute left. I just, before we can conclude two things I just want to reiterate, that if other issues have not been raised, you'd like to raise those after the call on an ongoing basis with us and have us, facilitate or get you to the right agency. We're happy to do that. I don't know. In closing, we have half a second left. Kathy, I just want to welcome you to the family, the federal family, the disability stakeholders, and I do think we're all one family. And I know there's a lot ahead of us that we can do all together. So with that, Kathy, I don't know if you have anything else, but I'd just like to, unless you have something.
Sorry, I'm so sorry for the technical difficulties, but I just want to extend my deepest gratitude. It's wonderful to see our federal partners as well. Hello to my former colleague, Yvette Rivera, looking forward to working together again. And thank you so much for the advocates, especially for your good ideas about how to resolve some of these inequities. And so we are looking forward to receiving your letter and more details. As you said, we have a fantastic team led by Becky, and community engagement is an important part of our work as in partnership with you all. Thank you so much for your time, your ideas, for sharing your lived experiences and giving us ideas on how to make things better.
Thank you so much. Thank you, everyone.
Shaylin, and thank you all again. We really appreciate this opportunity and forward. We know this is only the beginning of many conversations ahead, and we look forward to them. Thank you all so much.